As wealthier nations are racing to vaccinate their populations against COVID-19, Africa has so far secured only 1/5 of the vaccination doses the continent needs. The African Union says it has secured 270 million COVID-19 vaccine doses, which will be made available this year. This will supplement the 600 million doses obtained by the World Health Organization's COVAX Alliance for Africa. But some African nations aren't willing to wait. Guinea is now testing Russia's Sputnik V vaccine and has ordered 2 million doses. South Africa has ordered 20 million doses of the AstraZeneca vaccine, and Kenya has ordered 24 million, which should start arriving by the end of next month. But that's not soon enough for many health workers who feel they are being exploited. They've gone on strike to demand better pay, medical cover, and adequate protective gear. DW's Mario Muller reports from Nairobi.
Dorcas Mogore loves her job as clinical officer. A big part of it, though, was to work closely with COVID-19 patients. Then one day, she got sick herself.
I survived COVID. I went through a lot of problems. After I was infected, I didn't have a medical cover which could cover my bills, and I got so sick. I was supposed to go on oxygen. Both of my sons were infected too. It was very traumatizing.
She survived. 9 of her colleagues did not. And then another shock. She had to pay the expensive hospital bill from her own pocket. For over a month now, she's been on strike. With her, nurses and medical lab officers, more than 30,000 healthcare workers, according to the unions. Their demands include protective gear, health insurance, and compensation for families in case of death.
If any of us is to die from coronavirus today, their family is going to live in destitution. And as if that is not enough, then they tell you if you do not go back to that unsafe working environment, we are going to sack you.
Indeed, healthcare workers across Kenya have lost their jobs for participating in strikes the government says are illegal. We put the healthcare workers' demands to the Cabinet Secretary of Health, Mutahi Kagwe.
We have more than enough PPEs in this country. Since October of this year, we have got the most generous insurance package that has ever been given to the civil servants. They do have some legitimate issues that they have raised with us. For example, delays in their payments and so on.
The reason for those delays, says the health minister, is the current economic situation.
Nobody is denying that you should be getting your money. You should. It's a legitimate right. But we are also saying that when there is this situation in the country, let's also face it together. And don't make it look like you are blackmailing the government at its weakest point.
As Dorcas doesn't feel protected by her employer, she's awaiting the COVID-19 vaccine. Kenya expects to receive the vaccine through the COVAX facility, among other sources. But experts say a 60% vaccination target is needed to achieve herd immunity on the African continent. Meanwhile, wealthy nations have reserved more than half of the vaccines, even though they're home to only 14% of the world's population.
So there is kind of some selfishness to say, let us first reserve enough for our people. I think the issue here is that global responsibility issue. So you can reserve as many as you want for your country, but what is your responsibility to ensuring the world is safe?
To be safe, that's also Dorcas' wish for herself and her colleagues.
How do you feel about that, that Kenya and other African countries get the vaccination later?
Yeah, we feel like we are less human. We feel like we are not considered. But anyway, better late than never. At least we are hopeful we are going to get the vaccination.
Kenya's first tranche of 24 million vaccine doses is expected to arrive next month. Dorcas now hopes the vaccine will finally ensure her safety.